Um, Martin Harris, pharmacist and nutrition medicine practitioner from New Zealand. Yeah, I can really attest to the stuff that Andrew's done in the past. I did a program with Andrew about a year ago. Who knows what's related, but here I am standing up presenting for an award this year. So a lot of changes have happened in the last year for me. For me, leadership is really about, I guess, standing up for what's right, putting in the effort and doing what really is important. And it's kind of hard for me as a pharmacist when I've got my doctors next door who are always on my back about trying to sell their patients stuff. You know, why am I selling their patients stuff? You know, and if you really have understood the whole why you're doing what you're doing, it's really hard to stand up. If you don't have those beliefs really nailed down, you can lose where you're going and why you're going there. So, you know, it's one of the things keeps coming up again and again in Adam's sessions is really getting clear on the why, and I'd recommend you all do that, because that, I think, has been really important for me to keep me on track and to be moving forward. So I started my my life as just an ordinary pharmacist, and I spent a bit of time out of community pharmacy in the corporate world. I decided that I'd go back into community pharmacy, and when I got back in, hardly anything had changed apart from the natural health category, and there's a truckload of vitamins on the wall, and I'm thinking, geez, I don't remember learning anything about those at pharmacy school, so I better start learning about them. So I went on a bit of a learning experience to try and figure out what's going on with these vitamins so that I could help people to use them safely. You know, even if they don't work too well, at least let's not do any harm. But the more I learned, the more I realised the power of nutrition medicine, and I eventually ended up enrolling in a master's course with the top practitioner just up in Brisbane, actually, and just love what I do. And then I kind of figured I've got a responsibility to share that knowledge with as many people as possible. And to me, again, that's about leadership. You know, you can't just take the knowledge you've got and hide it and use it for yourself, for your own health, your family. You've got to share it with as many people as possible. So I developed a clinic inside my pharmacy. I cleaned out this junk room upstairs, mezzanine floor. I created half a dozen offices, infrared sauna, testing rooms, etc. Got in a couple of naturopaths, massage therapists, and we started running a clinic myself as well, seeing patients. And that was going really well, but seeing the people I was getting referred to me were like really sick. You know, they're kind of like the end of the road, and you can get some good results with those people when you can get them to comply with what you want them to do. But it sort of seemed to me that there's all these people downstairs coming into the pharmacy with prescriptions, you know, and they're just, you almost need to intervene at that stage rather than wait till they're so sick that they come to see you in the clinic. So I started trying to develop systems within the pharmacy, because I wasn't in there much, I was in the clinic, that my other staff could help those people. And I came up with this program called Optimal Prescription Health. And so when people came with their prescriptions for, say for example, a heart medication, we talked to them about just the basics, so fish oils and magnesium and CoQ10 and those sort of things, or when we had, you know, people coming in with you know, sleep disorders or depression or whatever else, we'd talk about the nutritional things they could do to support their health in a subtle way that didn't take away the relationship they have with their own GP, because these people are coming with a bit of paper from their doctors. So that was the next step, and I thought that'd be really important to help a lot more people than what I could do in the clinic. You know, see maximum of 2-3 people a day with the amount of time I spend with them. And then sort of from that, I created some really cool results for people. In fact, I'll read one to you now. Excuse me while I grab my laptop. This is supposed to be on my oh crap! It's supposed to be on my phone, but I'm having all sorts of problems at the moment. I had a lady that came into my pharmacy on a Saturday, and she had an experience, and she wrote to our head office about her experience. Now, when head office rings and say, "We've had a customer write in about you," you think, "Ooh." I'll bend over. Anyway, this is what she wrote. Dear editor, a few months ago I walked into Massey Amcal Pharmacy to get a prescription and noticed some information on joint care. As I had been diagnosed with osteoarthritis about a year previously and with excruciating pain in my knees, I asked for some advice. The sales assistant said to me Martin Harris would be the man to speak to, so she went and got him. After a lengthy conversation with Martin to find out a little bit about my medical history, he agreed that the pack he'd put together with glucosamine, SAMI and vitamin C powder was a good place for me to start. They sold the packs in 1 month lots, but he had also put together a special deal for a 3-month course, which also came with a free consultation with a naturopath. I jumped at the chance to buy the 3-month course as I was determined to give it a go, and I thought that after just 1 month I'd probably give up. Also, the session with the naturopath interested me, as for many months I've been feeling quite depressed about my general well-being. I had my session with the naturopath, which was very beneficial and put me in a better frame of mind and feeling better about myself than I had for a very long time. I've since purchased another course of supplements. I keep a food diary to watch what I eat, as well as foods I could be intolerant to, and joined a gym to assist with strengthening and increase my overall health and fitness. I've been so grateful for the advice I received from Martin and his team. It was nice to have someone listen to me about the issues I had and be sympathetic to my needs. I was also appreciative of the follow-up phone call I received after my consultation to see how I was getting on. I'm now feeling so much better about myself, and I've certainly taken heed of the advice given, and I'm well on the way to achieving the goals I've set myself. So that was, pretty awesome. We won Best Customer Experience for the whole of the Pharmacy Brands group because of that, that letter. But the key thing for me is standing up and saying to people, there's stuff you can do to turn your health around, and taking the time and putting the effort in. When you think about it, what can you do for osteoarthritis if you go to your GP? You can get some pain relief. And usually it's pain relief that actually destroys your cartilage. So, it's... And then I started thinking, I'm doing all this stuff, and I'm trying to help all these people, and I'm trying to get all my staff to help all these people. What if I could get more, get more leverage? So I put together, an idea if I could get trained pharmacists about the basics of nutrition medicine and give them the confidence, because a lot of pharmacists have actually lost confidence in their clinical abilities. I don't know what it's quite like here in Australia, but in New Zealand we've been backed into a corner in terms of all our contracts and all the financial pressures from the government, and it's a conveyor belt. You get scripts in and you flick them out as quick as possible. Most pharmacists bag their scripts and hand them out, and that's a good way to stop having to talk to somebody. If I put it in a bag, I don't have to even talk to you about your medicines. So at the very least, encouraging these people to get out in front of the shop and have an interaction and get all their clinical knowledge back out and make use of it. Or, like me, start learning the new stuff that you can add on to really make a difference to health. So this month, actually it was last month, September, I put together a webinar for pharmacists. I sent out 2 faxes and I got 65 pharmacists enrolled to do my webinar, which was designed to enlighten them about the power of nutrition medicine for patients' health, but also to unlock a lot of the power in the whole natural health category and the financial rewards from that as well, because they're business people too. Now 45 people showed up for that webinar, and I got some really, really cool feedback from them. I ran another one a couple of weeks later. I was really happy. I got 13 of those people signed up to do my certification course in nutrition medicine, and they're paying $1,500 a piece to do that. So that was $19,000 off an hour's work. And I was so excited about that, and I spoke to Adam about it, and the first thing he said was, great, do another one next week. Really?
Just insightful, isn't it?
Then he wallowed my victory already. So I did one the following week, and I got 35 people enrolled, same fax, just sent out again. 25 showed up, another 6 enrolled, so that's now up to $25,380 off 2 hours work. And so it's shown to be kind of replicatable, and now he's saying, you need to do one in Australia next week, Martin. So, yeah. But anyway, here's some of the feedback that I got from some of the guys. They just sent me emails the next day. I didn't ask for any feedback or anything. Thank you for the webinar last night. Found it very interesting. We have seen a great increase in some aspects of our natural health area, e.g. probiotics and CoQ10. After listening to you last night, I felt inspired and also realised how much I didn't know and the potential to grow this area even more. Please send me the registration forms for your course. Look forward to more info. Love and kisses, Marianne. I just put the love and kisses in. I actually don't know what Marianne looks like, so I don't know whether I want that.
She's kind of like a woolly. 103 kilo rugby player.
There's one sheep joke every day, doesn't it? Yeah. Next person wrote to me, I really do hope I can be selected to do this program, as watching your video today has really ignited the fire within me to be a pharmacist who's giving out more information about how to really improve health with a complete approach. And that was Sam. Other one, thanks for last night's presentation. Really interesting and obvious, easy and obvious to see how it will add value to our business. Intrigued. So it really has hit a chord. For me, it's all about leadership. For those guys, they do need leadership. They've been sort of backed into a corner, and I think, you know, if we can inspire those guys to do a bit more and up their game, and, you know, if that's another 20 pharmacists that are doing what I'm doing, and if they're making a difference to even only one patient each, like Debbie's testimonial there, that's a big enough difference. But, you know, these guys are generally seeing about 100, 150 patients a day, so hopefully they can make a big difference to the world. Thank you.